I think what a lot of people don't realize is I didn't really pursue a career in medical aesthetics.
Cosmetic dermatologist, Dr. Patrick Treacy.
Dr. Patrick Treacy.
Dr. Patrick Treacy.
Patrick Treacy.
Dr. Patrick Treacy.
Hello, I'm Dr. Patrick Treacy, Visiting Professor in Dermatology, and I'm globally recognised being one of the pioneers of aesthetic medicine.
Dr. Patrick Treacy is recognised as one of the most influential aesthetic practitioners in the world.
Over the last 20 years or so, I've won awards for the introduction of hyaluronidase into the field of aesthetic medicine. I've also worked quite a lot with Botox and migraine and sweating in the early stages, and would have done a lot of research on the use of Botox and depression. I've also lectured initially on PRP, but introduced it to male pattern baldness, and won awards for that back in 2007, 2010. And of course, when HIV plagued the land and the early drugs caused lipoatrophy, we were the first clinic in the world that I'm aware of that reversed, I suppose, the visual facial deformities in these patients.
Being named for the third time amongst the MyFaceMyBody Ultimate Global Aesthetic Leaders in Las Vegas 2019, Los Angeles 2018, and London in 2017. Dr. Patrick is among a few doctors in the world to have won the coveted AMEC Trophy 3 times for varied research relating to the use of stem cells and platelets in treating cancer cachexia and reversing skin necrosis.
Over the years, I've been interested in journaling within aesthetic medicine because I would have advocated or been a pioneer in some of the breakthroughs scientifically that we've had. And originally, even with the HIV lipoatrophy people, a lot of these people were suicidal. They suffered from social isolation because they looked so gaunt and the fat had totally come out of their faces. And it was wonderful to be able to change these people's lives.
Dr. Patrick has received many international awards from the United States, UK, France, Monaco, Mexico, Azerbaijan and Pakistan for contributions to the development of aesthetic medicine.
In terms of international awards, myself and the clinic have done really well over the last couple of years. Ailesbury Clinic has won top clinic in Ireland 5 out of the last 7 years, and 2 of the years that we didn't, of course, we were closed for COVID. I've also won top aesthetic doctor in Britain and Ireland 3 out of the last 5 years, and I've won awards for the introduction of hyaluronidase to aesthetic medicine. I've won awards for the use of PRP and hair growth. I've won awards for wound repair, and I won top aesthetic physician in the world for work we've done on reversing vascular necrosis.
Dr. Treacy is globally recognised practicing throughout the globe, even working for the Royal Flying Doctor Service in Australia. On returning to Dublin, Patrick set up the Ailesbury Clinic, pioneering cutting-edge technologies in the new field of cosmetic dermatology, championing treatments including the use of Botox in non-cosmetic procedures. This brought global superstars to his doorstep, including the king of pop himself, Michael Jackson, Sinead O'Connor, and many others.
Dr. Drew from CNN had asked me about did we use propofol on Michael Jackson when he was in Dublin, and we did on 2 occasions. And then also I remember before Sinead O'Connor went on Dr. Phil, she had a little video on social media and she had said that I want Patrick Treacy here by my side to not only treat me but support me in this program. So there has been an international media profile that way.
Dr. Patrick has published 7 best-selling books, such as The Needle and the Damage Done and Aesthetic Complications, and is in the process of publishing several more.
I think anybody wanting to enter the field of medical aesthetics now, they have to do proper training courses and have a mentor. These weekend courses you can do in some British cities and come back and start a business, I don't think that's either appropriate for the patient or for the people who's doing the procedure.
Dr. Patrick's work extends beyond medical science to a strong passion for helping global communities, serving time as a doctor in Baghdad during Saddam Hussein's reign, Africa, Asia, Australia, America and the Middle East, and has major plans in the coming months to continue his humanitarian efforts.
In terms of the future of aesthetic medicine, I can see a whole crossover in combination with conventional medicine. For instance, we get a patient dying from cancer at the moment nobody is really looking at the aesthetics of the patient. They're going to give chemotherapy, which is obviously going to poison more cells, make the patient look worse in terms of weight loss. And I've done some papers on how to control cachexia. And as we live longer, we want to obviously look better. In many ways, I'm really looking forward to that whole new approach to medicine.